Ready?
Ready.
Okay, well, I guess we would just get started now. It's 101 officially. Hi everybody. Oh. I'm backwards, I can't see what you can see. Welcome to our session today about searching for health information.
It's gonna be a great one.
It's gonna be awesome. I'm Christine.
I'm Orby.
It's Orby. And today we are talking,
Yeah,
it just takes a minute. Okay, we're talking about three basic things, right? So we're going to give you a quick overview of what MHIKNET is, because we like to do that in case there are some new folks on the line. We're going to talk about the 5 steps for finding health information, which is the bulk of the session. And part of that actually is also choosing resources based on your information needs. So let's get started. We have our nifty online system here. And the first thing we need to do is make sure everyone can see where the question box is. So on your little icon bar thing at the bottom, it's a technical term, at the bottom of your screen, you should see that it looks like a little flower. That is the GoToWebinar icon. So if as you're going through the session today, you need to ask a question, you can't find the question box, the first thing you gotta do is click on that icon, and then it's gonna bring up a menu. Here we go. And it's got a few things. It indicates that you're muted or not muted, that kind of stuff. And there is an orange arrow. Thank you. That you can use to minimize. There's also the gray lines, and one says questions. So if you click on the little arrow beside questions, that'll expand that so that you can have a box to type in your question. So fairly straightforward once you find it. So first things first, we want to know if you found the question box. So we're going to start a poll here. Oops. And if you can just answer yes or no, that would be great.
Okay, the votes are coming in slowly. We'll give you a couple more seconds. So for those who have responded, you were able to find the questions box.
That's great.
Okay. Thanks for responding.
Excellent. All right, so then let's continue on. Sorry. So first we wanted to just give a quick overview of MHIKNET for anyone who might be new to MHIKNET. Basically, we are an online library service. It's run out of the University of Manitoba, and we provide library service to staff at Manitoba Health Seniors and Active Living, fee-for-service physicians throughout the province, and then staff of participating health authorities, which we've listed up on the screen here. That being said, anyone can watch our webinars. We would like that. But in terms of the rest of the service, those are the folks that we concentrate on. Okay. As far as who's on the team, you've got Orby and myself, and there's also Gail, who's another librarian, and Cheryl, who is our fantastic library assistant. And yep, thank you. If you have a library card, that's great. If you need to get one, on our website, there is a link that you can download a form. So you would just fill it out, send it back to us with a copy of your ID, just indicating which organization you belong to, and then we'll set you up.
Yeah, and it's best if you're attending our webinar and you don't have a card and you are eligible for one, we'd love if you could just sign up for your card, because then when you do need to utilize our services, then you're already in our system, you're all set to go. So it's really great to have for when you're ready for us.
That's right. Okay. In terms of the services that we offer, we do literature searches for folks. We have document delivery, which is just library language for we will find an article and give it to you. We'll send it to you in your email. There's also current awareness alerts. And of course, we do the training sessions like the one today. The only thing that is slightly different is access to UpToDate. So UpToDate is available directly. You don't have to go through us to access UpToDate. You just need your library card. So that's kind of nice. All right. Also, before we forget, if you happen to have a bookmark, we have recently changed our URL, so you're going to want to make sure that you change it to www.mhiknet.ca so that you can continue to get access to our site. At the moment, we are redirecting for the old URL, but that won't last. I think it's just a couple months.
Yeah.
Yeah.
Yep. So just update your bookmark.
So yeah. Okay. Now for the fun part. So this is what you all came for. So we're going to talk about finding health information, and the first step whenever you are looking for information is to ask a specific question. And sometimes it doesn't have to be that complicated. So we've got an example here. Should pregnant women take vitamin D supplements? Yep.
Easy question.
Easy question.
Nice and concise.
But sometimes you might want to be more specific, right? So for example, does taking supplements, either with calcium or without calcium, improve maternal and neonatal outcomes? Is an example of a slightly more robust question. And usually when people ask us to do searches for them, they have some stuff in mind, but maybe they don't articulate it. And so we are like, okay, well, yes, you want to know about coronary artery bypass surgery. What about it, right? You know, like, be specific, right?
Mm-hmm.
It helps when you're doing your search. And the reason that is that a lot of times it's helpful to break down your search question into concepts. And you'll probably have heard of PICO, maybe you've heard of SPICE. These are just kind of tools to help you kind of focus in on your question and make sure that you get at what it is you really want to get at, right? So thinking about population, if there's an intervention, what kind of outcomes you're looking at, all that kind of stuff.
And this is helpful. It's a helpful exercise for us to go through when we're trying to understand the questions you ask of us. But I know when I'm doing my own searches, it also helps me just kind of formulate, if you tell stories like I do, and you have kind of a million thoughts going through your head and you're interested in all kinds of things, thinking through your question with these prompts is really a useful tool, which is why we're starting off the session with it. So really think about who is your population. And sometimes you'll already know that, innately, but sometimes it's good for you to think like, oh, well, do geriatrics experience this? Do children or pediatrics experience this? Or what age group really am I? Is it men or women? Is it animals or not? What really are we interested in?
Yeah. And if we look at the question that we had up earlier about vitamin D, we can break that down, right? And so obviously pregnant women are the people of interest. We're looking at vitamin D, and vitamin D with calcium might be something we want to compare to. And then we've got some outcomes, although outcomes is not very specific.
Yeah.
But we'll refine that a little. And I kind of like to also think of it as, sorry, thank you. When you're doing a search, your search question is kind of like it's built out of Lego, right? So yes, I'm feeling the Lego analogy. So like each idea is like a brick, right? So, and you can take them apart and put them together as you're searching. And this leads into creating an effective search strategy. And when we talk about search strategy, it's not just where am I going to look, but also how am I going to look, right? So for our question about oral supplements for vitamin D, we've kind of got a little chart going on here. So we've got our population, which is pregnant women, over on the left. In the middle, we've got our intervention, so the vitamin D and the calcium, and then outcomes. And we've thrown out some outcomes there, right? You'll notice that I've got and going across the top and or going up and down. Because when you're doing a literature search, usually there's a lot of different ways to say the same thing, right? So if we're talking about the Lego bricks, if the population is the green bricks, you might talk about pregnancy, perinatal, prenatal. These are all kind of the same but different, right? So the bricks might be the long skinny ones, it might be the short tubular ones with rectangles, but green is green, right? So I'm interested in anything that has the words pregnancy or pregnant or prenatal or perinatal, right? And then as you go across, you say, well, I want those, but I also want the other things too. Like, yeah, it talks about the various pregnancy terms, but it also has to talk about vitamin D, where I'm not interested, right? And that's where the and comes in. Does that make sense?
That's good, yeah.
Okay.
And I mean, just to say it maybe in a different way, it's basically taking all of your concepts, all of your sort of green bricks about pregnancy, and so you've ored them all together, and then taking your vitamin D, your calcium, oring those together, and then oring all of your outcomes together, and you and each of those different Lego groups.
Mm-hmm. So the green and the yellow and the red.
Yeah.
Okay. So I guess, why don't we pause and see if there are any questions, since everyone could find the question box. Does anybody have anything they want to get clarification on, or burning questions that you want to start out with?
So much harder virtually. When we stare them down in a classroom, then we'd have you make the PICO question on your own, but a little bit harder remotely.
Okay. Well, then let's continue on. So the next step. So we formulated our question. Step one. We've thought about our strategy, how we're going to look for it. Step two, and step three is where are we going to look, right? So question for you. When you look for health information, where do you typically start? Do you do Google, PubMed? Do you go to your school textbooks, or do you go somewhere else?
Good old textbooks.
I just threw that in because.
Nice. I mean, often they have awesome information.
Mm-hmm. Okay, so we appear to be split between, oh, no, we got a PubMed.
Yeah.
But
waiting on a couple more votes. We'll give you like one more minute here, or 10 more seconds, I think, more accurately.
Okay, a lot of Google though.
Lots of Google, a couple PubMeds, and a couple other sources. We'd love to hear what other sources you are going to and searching. Could be up to date, maybe. Could be a colleague.
Could be anything.
Yeah, could be clinical practice guidelines. If you want to share with us which are the ones that you use, we'd love to hear that in the question box if you want to type those in.
Okay. In the meantime, I'm going to pass it to Orby.
Thanks. We're going to talk about UpToDate now. Now, you may have already attended one of our UpToDate sessions, but we're just going to touch on this really quickly. And if you haven't seen one of our sessions on UpToDate, or you're not familiar with it, this will give you a really quick overview, but we also have a recording of our previous UpToDate session that's on our MHIKNET website, so you can go there and watch the recording of that. So UpToDate, speaking of textbooks, is really like an electronic textbook. It's really easy to use, and it's to help you with making clinical decisions. So if you are writing policies, or you're not seeing patients, probably not the right resource for you. But if you are looking for, what do I do when a patient presents with the pain in this part of the abdomen? This is the tool for you.
Or even if you're just looking at what standard practices. Right?
Exactly. Yeah. So it's got over 10,000 topics. There's the drug database, which is excellent. There's also patient education resources, which are really helpful if you wanted to give your patient some good information. Lots of graphics, and also medical calculators. So this is something that the province, since 2016, Manitoba has been paying for almost every health professional in the province. So even those people that are outside of MHIKNET, like the employees at Cancer Care, you all have access. If you need help in accessing it, we're happy to connect you with that. And on our website, again, we've got an easy to follow handout about how to do it. So UpToDate, great when you're looking for an overview, when you're looking for a medicine related topic, and if you're looking for those step-by-step instructions. So it's super, super easy to use, very similar to Google. There's just one search box in the middle, and often UpToDate kind of reads your mind when you're when you're touching it. I'm just going to exit out of our PowerPoint slides, and I'm going to take us to.
While you do that, we've got a question.
Oh, okay.
I'm assuming it's about up to date. Can it be used for best practice evidence?
So UpToDate does, it is in a way, we were having a problem when we were logging in here. So there we go. Okay, I'm just gonna blow this up to make it bigger. So best practice evidence. UpToDate, many consider it a source of best practice evidence. If you ask librarians, we'll say it's not. But it's a really great source to go to. We always caution everyone against only relying on one source. So definitely you can, and sometimes though, there are some things, some real procedural things, and UpToDate is the only source that I've ever found that has some of those. So sometimes absolutely it is the best practice evidence. Other times it's a little out of date, or maybe there's more rich content that's available elsewhere. So definitely worth giving it a go. Definitely consider it as part of your entire repertoire, but I would never just, find an entry in UpToDate and stop there.
Yeah, and I think this kind of ties in with something we're going to talk about later, which is critical appraisal. So.
Great point. So in UpToDate, you can search any kind of topic. I'll search on earwax removal here, and the two. So UpToDate is really good at interpreting and translating the terms that you're using. So I entered the very layperson term of earwax removal, and it comes back to me with the. I'm always having trouble saying it, so I don't know why it's always the example that I use. Cerumen? Cerumen? Do you know how to say it?
I don't.
Yeah. And then there's also a patient education version here. So I'll click on this one. This is a classic example of the step-by-step steps that it takes you through. On the left-hand side are all of the headings. So if you were really, if you really don't care about epidemiology and anatomy and you just want to get straight here to the removal, you can come, and if you're interested in, let's say, irrigation, then you can just sort of navigate quickly to the irrigation section. Otherwise, you can just read through, and it takes you step by step through different, not only the techniques that you should be doing, but also the different techniques that exist and the evidence that's available to support each of them. If I come back to the search here, and I want to look at the patient education one, so maybe I have a patient with me and I want to give that patient some information to take home, then it's a lovely little handout that's written in pretty accessible terms for a patient population, and then you can just print that and hand it right to the patient. So that's really nice. And that's kind of the gist of UpToDate. It's really easy to use, and it's a great first place to start for clinical medical information. So the next place that is really great to go to, and how lovely to see that a couple people selected it as their first source, and this is PubMed. So you can go to pubmed.gov, and again, I'll just exit out of the slides, and we'll come here to PubMed. And this PubMed is made freely available by the National Library of Medicine in the United States, which is, one of the largest services, I think, that is available to health in the world. It's free to search, and it has over 26 million biomedical, health, life science, behavior science, and bioengineering topics, so all kinds of things. And also note that you'll want to tune back in probably February, because PubMed is launching a really new version that's going to be a really big overhaul of its current interface. So there's some beta versions going on right now. If you're really super keen, you can give that a try. If not, join us back again in February when all the bugs will be worked out and we can just show you.
Hopefully all the bugs will be worked out.
Hopefully.
Why don't you give the pregnancy and vitamin
Oh
D
yeah,
a try?
sorry, that's what I should have done in my up-to-date example. Okay, so you can, PubMed does, it's not as smart at understanding what you're asking as up-to-date is, but you can see here it's already prompted me for my vitamin D prompt, and then I'm gonna add in an and I'm gonna do pregnancy or pregnant or prenatal. Okay, and I'm also just gonna put some quotations around my vitamin D, and then I click search. So pretty easy. I could have also just written vitamin D and pregnancy.
That is also an option.
Yeah. And so we'll just wait for the results to come up. The highlighting comes up because I am logged into my account with PubMed, and I just like my terms to be highlighted. So again, if you're interested in sort of more of those features, join us back again in February for that. And you can see here, so along the left-hand side are some filters that you can apply if you only wanted clinical trials or review articles, if you only wanted articles that were freely available, if you wanted to filter by date range or by species, and there's additional filters here. So some pretty, standard database options if you wanted to narrow your results, because you can see here I got over 4,000 results. So that's a little bit a lot. You probably don't want to read through them all. If I'm looking at each record, I can just see here, the underlined version here is the title of the journal. Then I've got information in the first line about the journal, so the year it was published and what volume and issue. Then I've got the title of the article, followed by the authors, and then the abstract. And if I come down a little bit further, it'll start to show me the keywords. And then along here, I've also got a link to a free full text article. So lots going on in PubMed. Give it a try. It's got really great authoritative information. It's journal articles though. So it has, if guidelines have been published in a journal article, they're likely to be in here, but often associations don't publish in journals, they just have them in different places. So, and anything that's not in a journal, so any magazine articles or expert opinions or different kind of how-to procedural things, they're not going to be here in PubMed. But if it is journal articles that you're looking for or reviews, it's a great source.
I just wanted to throw in that first article. It looks great, and it is available for free. If there is something that you want to read and it is not available for free, you can request it through us, and we will find a copy for you.
Yeah, and so like this one, if I were to click on this Elsevier full text article, it's probably going to ask me to pay it a lot. Oh, then yeah, I'd have to click get access, and it's probably going to say, please pay $80 to read this article. And you can just say, no, thank you, and just, pop us an email or give us a phone call and say, I would like the full text of this email, and our lovely library technicians will send it to you.
Yes, absolutely.
Oh, and just one other reminder about in PubMed is that the search is not of the whole article. It's only on basically the information that you see here. So title, abstract, keywords, subject headings that, that the indexers have assigned, but it's not searching whole articles. So sometimes we know that sometimes you'll get some different searches if you're searching in Google, because it will look for those terms within the full text of the article.
Well, if it can see it.
If it can see it, that is very fair. Okay, next up is clinical practice guidelines. And so we've got our definition here, and these are sort of recommendations intended to optimize patient care, and they're informed by high levels of evidence. So guidelines are best, again, if you're looking for something clinical. So PubMed, for example, it will give you everything. The basic medical science, it'll give you policy and review and some clinical recommendations and the whole gamut of things. which is great sometimes if you're looking for effectiveness or efficacy or policy. But again, if you're coming for clinical recommendations, then guidelines are really great. And they're also really great if you know that there's research available on a topic. So if you're interested in something that's really new and you know that there's not a whole lot of evidence on it, there quite likely isn't going to be a guideline if there isn't that wealth of information to base the guideline on. So one of our favorite go-to places is provided by the Canadian Medical Association. And though it's the Medical Association, they do include all kinds of Canadian guidelines. So the nursing guidelines are in there, like occupational therapy, physiotherapy, they've got their guidelines in there. And they're also available many times in French and English. So they're always kind of changing what this looks like and what it's called. Now you might know it as Jewel, and so they're a company of the Canadian Medical Association. And again, you can search it freely, one search box. So I'm just going to put in vitamin D pregnancy. I'm not going to add any other, oh, didn't like that. I'll just search on vitamin D. And so it's number of clinical practice guidelines. I can screen through 14 pretty easy. Probably half of them are going to be in French anyway, so I can just go through quickly. These are all, I shouldn't say all, these mostly are all free. Again, if you run into that instance where you're hitting a paywall and you just want access to the full text, again, send us that citation and we'll send you that full text. Yeah, and again, filter on the left-hand side, so you can filter by specialty or condition or who wrote it, all kinds of things, the language. So this is a really great, they've got a ton of guidelines here, and they're usually really good as well at keeping it updated. So if a guideline has been updated, they have the old one and the new one, and then you have to sift through which is which. They tend to just have the new ones available here. Another guideline database that we as librarians love, and we know health professionals love as well, is TRIP, the Turning Research into Practice. Oh, and I will also mention that at the end of today's session, we will be sending a copy of the slides that we've used, and we are recording today. So if you missed something or you wanted to come back and try some of this out, then those tools are all available to you. Okay, so let's stick with our vitamin D and pregnancy, nothing too fancy here. So we're searching for TRIP. Now TRIP it also searches CMA's what is it called? Infobase. Infobase. The one we were just talking about. It also searches there, but it searches all around the world. So I love to search the Infobase first for the Canadian guidelines, but then often people are asking like, Orvie, what are other places around the world doing? And sometimes too, it has stuff that Infobase doesn't have. So this time our filters are on the right-hand side, and you can see here, Canada has 14 different guidelines. There's also, we can look at secondary evidence or primary research. You can search all kinds of different types of information here. I'll just click on the Canada guidelines. So there's 14. This is really great. And again, you can click through. I do find that sometimes their links are broken. So if you do find something in here and you're like, I really want this, but I don't have time to hunt it down, just send us that citation and say, I found it in TRIP. It's a broken link. Please, can you find it? And again, our techs are wizards and they will find it for you. Yeah, so this is a really great place. Most of the content in here is also open to you freely, so it's really great.
Yeah, it's handy.
Okay, do you want to go to Google or the slides?
Well, why don't we go to the slides?
Okay.
And then we'll go to Google.
Perfect.
I'm just gonna skip ahead a little bit. So Google is all kinds of good.
As surely you know.
As surely you know. It can take some finessing though. Like sometimes you'll type something in, and of course, as happens with Google, you'll get like 10, 100,000 results, right? Which is never terribly useful. But Google is good for a lot of stuff. So it is a good place to go when you're just kind of starting out, much like the UpToDate, where you want to get some basic information about a topic. You can see what's out there. Sometimes if you haven't had a lot of luck with like the trip or the PubMed, sometimes Google will help you out that way. It is more than just the research literature also. So we've got the point here, it's like, well, what are your patients reading? And I'm sure you can understand that there's good and there's bad that's out there, right? So you can kind of see what's available from different perspectives. And then also for different types of information. And I've got gray literature here, like government reports. So if you're looking for something along those lines, probably not going to be in your PubMed or your trip databases. Thank you very much, Opie. A lot of times we just kind of go to Google and fire off whatever we're looking, vitamin D and pregnancy. But there are some kind of things to keep in mind that can help you get slightly more refined results. First of all, don't worry about case. It's the same whether it's capitals or not capitals. And something that people don't necessarily think about is the order that you type things in actually makes a difference. So you can see here the first, or at least at the moment, because they tend to change the Google algorithm and then not tell us, and then you figure it out that things aren't working how they used to. But at the moment, it will think, okay, well, this is first, so it's the most important. Vitamin is more important than D. I don't know about that. But you can get around things when you use quotation marks. And quotation marks indicate a phrase, right? So vitamin D supplement looks for vitamin D supplement. All three strung together. If you don't, sometimes it'll be like, oh, there's vitamin up here and supplement over there. But the quotation marks can be quite useful, particularly if the phrase you're looking for is a standard phrase, right? That's used in the field.
And I also use that, as you saw, in PubMed, in Trip. Sometimes the more specialized databases like CPG Infobase, I won't use it there because I'm never sure how much phrase searching is there, but this is also a skill that you can use in other places. Yes.
I would argue that PubMed is not so useful with the quotation marks, because it works in a slightly different way, but we won't get into that. Spelling, yes. So one nice thing about Google is it tries to read your mind. So things like PubMed, like we were talking about earlier, where it's like, oh, pregnancy or prenatal or perinatal or this or that or the other.
Pregnancies, pregnant.
Yes.
You have to do that all yourself in PubMed.
Yes, whereas Google, it tries to figure that out for you. So if you don't think of all the different ways to say pregnant, you're
Google's
okay.
got your back.
That's right. Now, a lot of times people go, what is the blah, 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 blah? And
what is the best way for a pregnant woman to take vitamin D? Right. Should a pregnant woman take vitamin D and calcium?
And you really don't need to do that. Just figure out the key terms that you need. So vitamin D, calcium, and away you go, right? The extra terms, depending on what they are, they might kind of throw off your search. So it's slightly more useful.
Should we give it a try?
Sure, let's do it.
Okay, so.
I'll get you to type since you're ready.
Okay. Should pregnant women take vitamin D and calcium?
Okay, so we've got something from the American Pregnancy Association. I've never heard of them before. That's interesting. Okay, so we've got something from WebMD about pregnancy and pregnancy risks, vitamin D and calcium. You can see that's from PubMed because NCBI in the URL. Okay, so 9 things you need to know. Let's see what happens if we put in vitamin D in quotation marks and then calcium.
Oh, calcium or pregnancy?
Oh, yes, you're right. Sorry, I'm getting it for myself.
That's okay.
Oh, interesting. It got the same thing from the American Pregnancy Association. Go down. Oh, look at that. Oh, but we got a recommendation from the government of BC now, though.
And Cochrane.
And Cochrane, so that's interesting.
And a CTV News and World Health Organization. I'd say that just at a very quick glance, these results where I did not ask it a question gave me more authoritative results.
Just in the first few.
Just in the first few.
Yeah. So that's an interesting difference.
Mm-hmm. And sometimes on some topics, it won't matter whether you use quotes and flip those words around, you're always going to get the same results.
Mm-hmm.
Other times it can make such a tremendous difference.
Yeah, very true. So I would suggest just to try stuff out, see what works.
And if Google's not giving you what you want, because often it reads your mind and tells you right away what you wanted to know, but other times, you can kind of get a bit stuck. Mm-hmm. And so then using some of these tips is really helpful.
Yeah. And it says rarely go to the second page of results. I don't buy that.
I do. I know we vary on this one.
Yes. Because we won't go into incredible, excruciating detail today, but Google has certain algorithms that it uses to judge what you see first. A lot of that is based on what you've looked for before. Some of that is based on whether or not websites pay to get bumped up to the top. Mm-hmm. So just something to keep in mind. But you can have a quick look through, like it's only like 10 on the first screen, so it doesn't take long to go, okay, well, what's following? And if there's nothing showing up that's relevant, maybe try something else.
Yeah.
And you can also look for different formats, right? So we've got PDF and PowerPoint. So if, if we go back real quick, if I were to say, so file, PDF, I'm making it look for PDF documents, right? So so now we've got a whole different set of stuff. At the very top, we've got a guideline from the UK. We've got, well, that's interesting. Why is there's some other stuff here that's noting it's PDF, but I wonder why this stuff is not showing. Oh, interesting. Sorry, I'm thinking and talking at the same time. So it looks like there is a link to PDF here. So this is PubMed Central rather than PubMed. So it looks like it's got the link to PDF, and that's why it's showing up there.
And sometimes I'll use this, especially if I'm looking for some kind of government document, or if I suspect that an organization has published a report, but I'm not totally sure what that association's name might be. Or if I'm just looking, for like a report, more effective to search file as PDF than it is to say vitamin D pregnancy report.
Right. Because unless it says report, then it's not going to show up. Yeah, right. Okay. Now, just go back to the slides. Just some final thoughts about using our terms in Google. If you look for something that is very technical, you're going to get the technical stuff. If you look for something that's not technical, you're going to get less technical stuff. So our example here is myocardial infarction versus heart attack. They mean the same thing, right? So depending on what you're looking for, you might want to choose the technical term versus the layperson term, or vice versa. So like if you were looking for stuff for your patient, you'd probably want to use the term that would be used when you're speaking to patients, right? Alternatively, you might try both. Like heart attack is something that is thrown around a lot. So regardless of who's writing. So you might try to look for both things and see what happens too. Okay. All right. Google Scholar, we have to talk real quick about Google Scholar. It is very similar to Google in how it functions with the search box and everything like that. But Google Scholar focuses in on things like articles, books, patents, things like that. So it's less of the layperson kind of information and more of the scholarly stuff. So if you've ever looked for articles, sometimes you might want to go to Google Scholar rather than to Google just to see what the difference is in that.
Yeah. So. And sometimes there's really great things that you can get there. Sometimes you can find things that have sneaked their way into the scholarly literature and that are making themselves look like authoritative scholarly literature and really aren't. We call that predatory publishing. And sometimes too, I find like the title might be a beautiful title, but even if I've limited it by date, it still might be from the 80s or something on a topic that it wouldn't be relevant to rely on information from the 1980s. So it's a great source, not always the right source for what you're looking for.
Right. Okay.
Anything else on Google?
I don't think so.
Okay. So moving along to step 4, now that you've thought through your question, mapped it out a little bit, and you've decided on what sources you're going to search, go for it. So don't be afraid to, try things and try different tools and resources, and explore, because you never know, where one item might lead you. Now, all that being said, we can also do that for you, because I know sometimes it's sort of interesting and you learn a lot as you go along, and or you might want to take a little look into the literature before you're coming to us with, like, it might help you with your question formulation to kind of look around a little bit. But you can also just send us your question. The more well formulated it is, the easier it is for us to give you what you're looking for. But if you're not you're not totally sure, and especially if you're not totally sure what the state of the literature is, then send us your question as best you can. We're not picky, and if we run into trouble or if we run into tens of thousands of results, you'll hear back from us to say, okay, do you mean all these age groups or just some of them? Or do you mean vitamin D in, like, I think we had specified oral, but if we had said, is it oral and, absorption through the skin and, I don't know, intravenous, if that's such a, exactly. We'll come back to you with clarifying questions like that. So we then, and not only can we search the free resources that are available, but we also can search all of the resources that the University of Manitoba Libraries subscribe to. So it's some really rich databases that we can search. Then we'll send you that list of, we can send you then a list of references, and you can say to us, hey, I just want like 10 references of review articles to give me an idea of what this literature is like. You can also say, I need everything that there is on this topic, and we will provide that for you. And then the final step in our searching process is critical appraisal. Now, if you've been to our sessions before, you know that we always talk about critical appraisal because it's so important. And this is the assessment of what the information that you're looking at. And the sort of the depth of your and rigor of your critical appraisal is also specific to your question, what you're going to be using it for. And so we've highlighted here, were the methods used in this study good enough that I can be confident in the findings, sort of for what you're doing. So, if you just wanted to have like a little bit of an idea about something, that's a lot different than you're going to write the provincial guideline on how health professionals are going to inform their practice, right? Like 2 different levels of rigor on that one. So we've got two tools here that are helpful to sort of form that critical appraisal. I really like the CRAP test because it's an acronym, and then you can quickly think through these steps. Is this current enough for what I'm looking for? right? So sometimes information from the 1980s would be totally fine. Other times you need information only from this week. And what is the reliability of it? Who's the authority? Or is the person writing it an authority? And what is the purpose or the point of view? So those are just like really great. Those are great, especially if you're on Facebook or social media or hearing things in the news, just to go through this quickly and say, you know, is this being paid for by the Ukrainians? Did you know that they're the new Russia in the election?
Oh, are they?
Yeah.
Okay.
Good
to know.
Yeah, good to know. So that's your reliable this morning. That's what the Daily was telling me. And all, you know, so is this person trying to sell me something? Are they trying to propagate a certain point of view? Also, if you're finding a point of view, seek out the other view to try to balance it.
Right.
There's also this really great infographic. You might want to print this out and put it on your bulletin board. It's the same things. Consider the source. Go beyond what this is just saying, or read the whole article. Don't just read the headlines.
That's true. Yeah.
You know, check the author, check the date. Is this a joke? We do our best critical appraising on April 1st every year. And, you know, check your biases, all this kind of stuff. So these are some really great tools. They're easy to use. There's also, again, so I like the crap test and that how to spot fake news for newsy kind of things, right? If you're looking then, you know, into the journal literature, into guidelines, there are some really great critical appraisal tools by CASP. And they are specific, so for the publication type. So if you're reviewing a systematic review or a randomized controlled trial or whatever kind of research you're looking at, there's different critical appraisal tools that you can use for each of those kinds of research.
Yeah, and on their website, they've got checklists that you can use, so that's handy.
Yeah. So in summary, we've got 5 steps for finding health information. Ask a specific question, create an effective search strategy, identify the best sources of information for that particular search, actually do the search or have us do it for you, and then critically appraise the information. So we can help you with steps 3 and 4, or we can do those parts for you. We can help you with steps 1, 2, and 5, but those are the steps that really are up to you. So that brings us to the end of our presentation. We're happy to answer any questions you may have. And again, we will be sending out the slides for you so you can have some reminders. And we always record our sessions. If you're interested in some of the points that we talked about, like how to search PubMed, more on clinical practice guidelines or critical appraisal or UpToDate, all kinds of those things, we always post the recordings of our past sessions, and we've got some more sessions already lined up for fall, including Google's going to be in November. Yeah. And next month is,
That's a good question.
What is a good question? We were so focused on today. We're having another one tomorrow, or another one next month. Right. Yeah, so you can always come to our website. It is MHIKNET.ca. And right here, then it lists in October, oh, we are doing Keeping Current.
There you go.
So that's going to be a great way to how to keep current in your area. You can also always contact us by email or by giving us a call. And Christine is at Manitoba Health on Tuesdays and Thursdays.
Yes.
So you can always pop in to see her. Anything else you wanted to add? Is that anything?
I don't think so. It's a bit of a whirlwind. So we can take a few minutes if you want to type in some questions. We can certainly do our best to answer. We have a little bit of time we put aside for questions. But yeah, it's one of those things that the more you do, kind of the more comfortable you become with searching for information.
Yeah. So
we are always here to help, but by all means, don't feel like we're going to make you come to us.
And too, with the question formulation, sometimes our clients email in with very beautifully articulated PICO questions, and sometimes we get like little stories about, I'm having this thought that I want some information about this, but I'm not totally sure. We work with all the kinds. Yeah, right. We're happy to help on all the searches. Okay, no questions.
Everyone is now an expert.
Or they're busy testing out some of the tips that they were thinking like, oh gosh, I was looking for a guideline on this.
We've got a hand. Who's got their hand up?
Oh.
What happened there? Maybe if you go scroll down the list. On the right? Yeah, with the arrow.
Oh, I see.
Nope. I don't, maybe they put their hand down.
So that's okay. We'll be here for a few more minutes. That's the end of the session that we prepared for today. And you're welcome to get in touch with us anytime.
For sure.
Thanks for joining us. Happy Learn at Work Week.
Happy Learn at Work Week.
Okay, we're going to sign off. Thanks everyone for joining us again. And we will hopefully see you again in October for Keeping Current.
Bye.